Morning, good afternoon, and good night to our evaluator, which is Dr. Wayan Surudarma, M.Si, and to our facilitator, which is Dr. Cokorde Istri Yuliandari Krisnawardani, M.Biomed, spesialis penyakit dalam. Now we want to presentate about our student project, which is titled is Benefits of Reiki Therapy for Anxiety. So this is our member of SGD B8.
Hello, my name is Nolina Saraswati with the last 3 digits of student ID number 142. Now I'll explain about the background of this student project. So anxiety is defined by the American Psychological Association as an emotion characterized by feelings of tension, worry, thought, and physical change such as an increase in blood pressure. At present, treatment is not only through medical treatment, but also has used complementary medicine that is useful for alleviating some of the problems that arise due to a disease. There are several types of complementary therapy, one of which is energy therapy, namely Reiki therapy. According to the National Center of Complementary and Integrative Health, Reiki therapy is classified as a biofield therapy and is a non-invasive intervention derived from Buddhist religious book. Reiki therapy is defined as a universal energy channeling technique aimed at reducing stress and relaxation to promote well-being, and is classified as an energy healing therapy. Reiki therapy is increasingly being used in mental health counseling and has medical use in treating anxiety, depression, and pain. Until now, the effectiveness of Reiki therapy as a complementary therapy in conventional healthcare is not fully understood. However, in some literature, it is stated that Reiki therapy is offered as a cost-effective and non-invasive treatment option that can improve patient care. Therefore, in the student project, we will discuss the effect and benefits that patients can get from Reiki therapy. That's all from me. The presentation will be continued by my friend. Thank you.
My name is Krisnawardani with the last 3 digits of student ID number 108, and I'll be presenting about the problem formulation of the student project. The first one, what is the definition of Reiki therapy? The second one, how is Reiki therapy developed? The third one, how are the techniques and methods of Reiki therapy practices? The fourth one, how is the application of Reiki therapy? The fifth one, what is the scientific evidence of Reiki therapy? And the last one, what are the benefits and potential side effects of Reiki therapy?
Next, the objective of our student project. The first, to know the definition of Reiki therapy. Next, to know how is Reiki therapy developed. To know how are the technique and method of Reiki therapy practice. To know how is the application of Reiki therapy. To know the scientific evidence of Reiki therapy. And the last, to know the benefit and potential side effect of Reiki therapy. And for the benefit of this student project for us as a medical student include complete knowledge about Reiki therapy, starting from its the definition, develop, technique, and method, the application, scientific evidence until the benefit and potential side effect of Reiki therapy. And for the scientific learnings that we can learn more about Reiki therapy, and same with the community, include the increasing knowledge in the community so that they have a better understanding of Reiki therapy.
Hello everyone, my name is Ananggung Ramudikar Parawangsa with student number 200251193. I would like to continue the presentation by explaining about the definition of the Reiki therapy. First of all, the word Reiki is a Japanese word that can be interpreted as the vital energy of the universe. The term of Reiki itself is actually a combination of two different words. The first one is Rei, which is meaning high intelligence that guides to the creation and the functioning of the universe. That wisdom come from the God itself, who become the creator, source, a universe, or everything, the one who knows everything and understand the needs and cause all problem and how to solve them. And the second word is ki, is the vital energy that flows through all living things, such as humans, animal, and plants, and present somehow in everything around us, even on living object. So we can conclude that Reiki is a holistic therapy that perform as treatment to increase self-awareness and spiritual growth, and is believed to be able to treat, balance, and restore the global harmony of the individual, human, or the patient, like the body, mind, emotion, and the spirit. Now we talk about the Reiki therapy. Today, Reiki therapy is known as a therapeutic practice originating in Japanese culture, of course, which use the laying of hands, which is believed to channel the life energy to stimulate the natural mechanism of recovery and maintain the patient health. And the natural well-being that is obtained is the result of energy transfer, which activates the energy centers or well known as chakras. And the practitioner is the channel through which energy is transferred without interfering with the process, which are unique and individual for each person. In addition, Reiki can be used as a complementary therapy, can also be used as a parallel with all existing medicine and therapies without ever replacing or contradicting any of the medicine or the past therapies from the patient. Thank you.
Hello, my name is Jeffrey Novianto. Villa student ID number is 091. I will continue about the history. Reiki was discovered by Mikao Uzui in Japan in the mid-1800s. He ascended to Mount Kurama and started performing penance while fasting. And within the first day, he felt a Reiki over his head. Then, Usui Sensei moved to Aoyama, Harajuku in April 1922 to offer this energy widely to many people.
Hello everyone, my name is Bagus Mas Manabu with a digit number 210. I'm going to explain about the techniques and method of Reiki therapy. Energy medicines aim to help the flow of energies and remove blocks or in similar ways to acupuncture and acupressure. The techniques that Reiki involve have names such as centering, clearing, beaming, extracting harmful energies, infusing, smoothing, and raking the aura. Some Reiki practitioners will use crystals and chakra healing wand to enable healing or protect a home from negative energies.
Hello, my name is Dewi with the last three-digit number 005. I will continue to explain the techniques and methods of Reiki therapy. In the Reiki session, the recipients can be lying or seated position with their clothes fully wear on. Reiki methods use the light touch on above the physical body. To govern all of the body area and function, Reiki practitioner could use several hand positions that cover the area of the endocrine and major glands. Reiki skilled practitioner could also turn the unbalanced area of the body, and it is important to always ask for permission and consent before touching someone for Reiki session. Reiki session could last from minutes to several hours according to the condition.
Okay, thank you for the opportunity. Now, I would like to explain the application of Reiki therapy. Well, Reiki therapy itself is a very complex mechanism where it has not really been described clearly on how it actually works. However, it has shown a relevance to quantum physics and also the field of bioenergy. Therefore, it focuses on the belief that when we have a disease, it means that our own energy is actually in a block and it cannot flow steadily within our own body. Therefore, the application of Reiki therapy aims to actually stabilize the flow and channels one energy into another one, into your own body in a steady way. Now, a typical session is around 30 to 90 minutes based on each patient's condition. However, it has shown that it can release stress and also change perspective and give us something new and more focused. This will help a lot in mental diseases such as anxiety, where we know that Indonesian anxiety incidence is very high, reaching up to 34.6%, especially in the pandemic recently. The theory underlying this causes the blockages in the body's energy to be fully released and can come back and flow naturally again. That is all. The presentation will be continued by my friend.
Hello, my name is Devi Asianto with Rila student number 163. Here I'll be explaining about the scientific evidence. Reiki therapy is one of considerably complementary treatments. Through the gentle contact, this energy healing practice promotes relaxation and lowers stress and anxiety. A Reiki session has several goals, including relieving stress and discomfort, promoting relaxation, releasing emotional blocks, accelerating natural healing, balancing subtle body energies, and supporting other medical treatments such as conventional therapy. Next, about further recent data analysis will be continued by my friend. Thank you.
Greetings, my name is Stefan Solbis with the last digit of my student number 113, and now I'm going to explain about the scientific evidence of Reiki therapy. The most recent data analysis conducted in 2008 until 2009 provides complete proof that Reiki does in fact cause a favorable physiological action in both people and animals. The most well-monitored of the studies reported that the strongest evidence rank outstanding in the process. All experiments known outside those using lab rats. Stress out reps, stress out lab rats that had Reiki treatment in both 2008, 9, 2006, and 2008, and afterward, all of their symptoms of stress, anxiety, and sadness were dramatically diminished. The placebo group received Reiki treatment that had no effect on their levels of stress, anxiety, or despair. Testing on people between 1993 and 2006, all of which suggested that Reiki treatments were effective in reducing human pain. To date, very few high-quality studies have explored the use of Reiki therapy for pain or anxiety due to the relatively small number of studies, dissimilar intervention, and different population presentation. It is difficult to make generalization or recommendation from these studies. Some differences were seen, such as individual treatment periods, which range from 30 up to 90 minutes, and population variation that varied from surgical patient to cancer patient to community dwelling adults. On the other hand, most of the studies were unable to approach statistical significance or reach significance on the variable of interest. Either anxiety or pain or both effect size calculation were performed using cohorts, which allow comparison of studies with standard methods based on the statistical significance, strength of effect size, and public interest in Reiki therapy as a non-invasive and even entertaining intervention. There is sufficient evidence to suggest further research using Reiki therapy. Suggestions for study design and standardization of treatment protocols are proposed to increase the potential for positive outcome in future research. That's all from me. Thank you.
Okay, so hello everyone. I will introduce myself first. My name is Cokorde with the last three digits of my student number is 165, and I will continue the presentation by explaining to you the benefits and side effects of Reiki therapy itself. So first of all is the benefits. So the benefits of Reiki therapy is actually a lot, and here's are some of the benefits, which is Reiki can relieve pain and anxiety. It also helps treat depression. It also relaxes the body and mind, and it also improves the quality of life. And the side effect of that may caused by the Reiki therapy is actually a low chance of side effect. Why? Because Reiki therapy is a non-invasive treatment, thus it has a low chance of side effect. And there is a lot of studies that shows how Reiki therapy is actually beneficial for a lot of diseases. One of them is for the cancer patient, where they can treat they can give this therapy to a cancer patient, and it may reduce the symptoms that they have that they are experienced when they went through this cancer. And thus it actually shows how good the prognosis of the Reiki therapy itself to any other diseases. It also shows how it has a really low chance of side effects. Thus it actually shows how good the prognosis of Reiki therapy itself. So that's all from me. I will the next presentation will be continued by my friend. Thank you.
Hello, my name is Christian Sinaga with real student number is 096. So I'll continue with the conclusion of our student project. So Reiki is a holistic therapy system that is performed as a treatment to increase self-awareness and spiritual growth. Reiki is first discovered by Usui Sensei when he ascended Mount Kurama and started performing penance while fasting. Reiki methods use the light touch on above the physical body. The techniques that Reiki involves have names such as centering, clearing, beaming, extracting harmful energies, infusing, smoothing, and raking the aura. Reiki also helps recenter several medical diseases, especially anxiety. In a short study, it is proved that older persons report reduced levels of anxiety, sorrow, pain, and other depressive symptoms after receiving Reiki treatment. So this is our bibliography that we use for this student project, Benefits of Reiki Therapy. That's all from us. Thank you for your attention.